many patients come to me and ask, do you have a cancer vaccine? And it's often called the dendritic cell vaccine. There are many people, many immunologists who create these types of treatments. It's based on the fact that there are certain cells in our body that are essentially watchmen. They're called dendritic cells. And they can be located in various tissues in your body. There's many in the skin, all over your body. And their job is to be a kind of watchman. And they're required to look out for unwanted invaders in the body. And they, in a figurative manner, take a picture of the entity, go into the immune system, into the body, and interact with the T cells and the B cells to communicate that image so that they can be educated, and no longer immature, but educated to noticing that entity and then doing the job of tagging it and the other cells engulfing it and eliminating these abnormal entities. It could be, the dendritic cells can be watching against all kinds of things, viruses, bacteria, whatever. But in the case of cancer, we have a special difficulty because our cancer cells are from our bodies. They're our cells. And so the mechanism that they use to exist and coexist with the immune system side by side it and being untouched is by excreting a sialoprotein called nagalase. And nagalase is very unique because it coats the cell and basically cloaks it from surveillance in the immune system, because there's a similar kind of coating on other lymphocytes. So when they come up to a cell that's cloaked with nagalase, they, well, okay, fine, it's just another cell. So they don't really bother it, and therefore it's cloaked. So when we want to try and identify what are the special markers of your cancer cells, those cells have to be stripped of this coating, and all of the proteins that are involved in the surface separated and then identified and categorized as to which markers are present most often in your population of cancer cells. So this is how they create the vaccine, and it's called dendritic cell vaccine because what they'll do is isolate your circulating tumor cells and stem cells, strip them, separate out all the different proteins, and identify which moiety is present most frequently, and then take your dendritic cells from your specimen and artificially educate them and imprint them with that marker. Then propagate that population of dendritic cells and then prepare that in a live cell administration or vaccine, send it back to us, and then we administer it to the patient over a 4 or 5 hour period of time. The idea is to create a population of dendritic cells that are educated with this marker, who can then go into the immune system and increase the CD80 and CD86 cells that are going to be the ones that will help do the work to kill the cancer cells. It's a somewhat involved progression of events in terms of its administration. It's a little bit more complicated than some of the other treatments. It's designed to be a permanent change in your immune system and a permanent addition to your immune system. So when a patient has made the decision to have the vaccine drawn, there's this very strict 21-day period where we have to administer it as soon as it comes back. And it's only viable for 48 hours. And then we have to monitor the patient in sequential periods of time to see if the cellular markers show that the dendritic cell population has increased, and then the CD80 and 86 population has subsequently increased as well. So it's a kind of a monitoring period for over a period of 6 weeks, 9 weeks, and then a few months and up to a year. However, it is designed to be a permanent defense against your cancer cells. The change in the way that this particular treatment has been made and administered, at least by the RGCC company, is that they now encourage you to continue to monitor the circulating tumor cell count and to continue to add other treatments such as the cancer SOT, which we just discussed, because the cancer SOT does monitor and present the possibility to treat new clones of cells that grow up in the meantime. So the concept that you can have a dendritic cell vaccine and be good for life and you're done with your cancer is not exactly true. So this is an extra added protection where you can synergistically apply the two treatments together with greater success and longer disease-free survival.